think what I find really rewarding in ear, nose, and throat surgery is being able to do surgeries and procedures that really improve people's quality of life. So much what I treat in the nose and the sinuses, chronic infections, chronic allergies, and nasal obstruction, sinus symptoms is very impactful on people's daily quality of life. So if I can make that better, I've made people's daily life better for, a long time to come. So when I meet a new patient, I like to try and find out what aspect of their condition is most troubling to them, what's impacting their life the most. Then I like to also try and figure out what parts are the most serious in terms of potentially becoming worse over time. Then I try to work with the patient to find the most minimally invasive but highest yield options first and kind of work our way up so that we can get the patient the most benefit with the least inconvenience, least recovery, least alteration to their life. So as ENTs, we do everything from medical management of conditions of the ears, nose, throat, and sinuses, all the way up through surgeries in the operating room and everything in between. So for a patient that comes in with chronic sinus problems or nasal obstruction, typically we'll start by making sure the patient is on the correct medical management first. If that medical management isn't enough, things like nasal sprays and nasal rinses, then the next step is often procedures. Many of those can be just done in clinic with local anesthesia, just some local numbing spray with pretty much no downtime and return to normal life later that day or the next day. For more serious conditions or conditions that are refractory to those more minimal interventions, we offer procedures in the operating room. And the good news is for a lot of those, there isn't a tremendous amount of recovery either. Many patients are kind of back to their normal lives in a day or two after those as well. We do a lot of what's called natural orifice surgery, which are surgeries that don't require incisions anywhere on the body, incisions that can be done through natural openings like the mouth or the nose or the ear canal. And because there's no incisions and there's no dissection of normal tissue, the recovery is a lot less. My wife was born and raised in the East Texas area, and she grew up mostly in Tyler. So when we were first dating, she brought me home to meet her family who were in Tyler. We went to the Tyler Rose Museum. That was my first kind of impression of Tyler 13 years ago, and it's interesting being back now to see how much Tyler's changed.